Mayor Wu has declared several heat emergencies this summer. It seems as though they're happening with more frequency. So, Doctor, what are your greatest concerns about the changes in climate and increasing temperatures and how that impacts our health?
So sometimes people look at heat emergencies and heat in general like it's an inconvenience. The reality is that it has a serious impact on health and can actually lead to death. If you look at weather-related emergencies and death, heat is actually the #1 cause. So these heat emergencies are serious for us, and we take them, very seriously. I think that one of the things that we need to be concerned about is obviously those individuals who are at highest risk. So those individuals with chronic medical conditions, heart, lung, things like asthma. We have a relatively high rate of asthma across our communities. Certainly we need to think about the youngest amongst us because they can't tell us when they feel dehydrated. And then think about all the people who are unstably housed around our city and those people who have to work outside and who can't make a paycheck if they're not working outside. So those are the people who are at highest risk, and that's what our messaging and our programming are really targeted towards.
How does public health connect to the environmental justice movement?
Well, we connect directly to the environmental justice movement. So Boston itself is a heat island, so it's hotter than the outlying areas. But if you look within the neighborhoods of Boston, there are areas that are even hotter. Okay, so these are Dorchester, Mattapan, Roxbury, Chinatown. These are areas in our city where we know that temperatures are going to get hotter, and people who have chronic comorbid conditions, they are going to do more poorly when the temperatures get hot. So those are the areas where we do target a lot of our efforts. We do enormous amount of outreach to those communities, and we ensure that people have the tools to make decisions, to know when they should go to cooling places, know what they should do in terms of accessing healthcare resources, because these heat emergencies do also strain our healthcare resources. During most heat emergencies, the
emergency room visits go up.
EMS, the number of runs that they have to make, it goes up significantly. So we need to be paying attention to these issues and ensure that people, are prepared and are safe.
How are you tying any of your office's work to what environmental organizations are doing around issues like changing the waterfront or improving the tree canopy in Boston?
So we're working very closely with the Environment Cabinet and the Mayor's Green New Deal. We are looking at those infrastructural issues, improving tree canopy, increasing, water features within parks, making it easier for people to cool in place. And that means sometimes, we got to make sure that people have air conditioning, and advocating for that. So I think that part of this is about the infrastructure issues, but part of it is the immediate needs, meeting immediate needs of folks and ensuring that they have places to go when things get too hot.
All right, now to a question about COVID. Here we go again. Infection rate is up. The president has tested positive.
Yes.
What does a COVID infection mean today?
It actually means pretty much the same thing that it meant, say, a year ago. What we're seeing in our wastewater, which is how we measure risk within our communities, is that the amount of COVID concentration, it's going up. The amount of viral concentration, it's going up. It's gone up about 31% in the last 2 weeks, which means that there are more infections out there. What we have noticed is that infections seem to be milder. And that's because there's more immunity out there. More people have been infected, more people have been vaccinated. So we are seeing that. We aren't seeing a huge increase in hospitalizations, and that's a good thing. And again, that's because of the issues related to immunity and having more widespread immunity. But this is still serious because there are some people, one, who haven't been vaccinated. There's some people who are immunocompromised. There's some people who are older and have chronic underlying conditions. Therefore, they may feel the impact of a COVID infection differently than others. There's also long COVID, okay? So we have to think about all these things, and our primary source of defense is vaccination.
Tell me about the new vaccine that's supposed to be coming out in the fall.
Yes, so there is a new vaccine that has been authorized, and that should be available possibly even late August, mid-late August, and into September.
Should we get it as soon as it comes out, or should we wait to the fall?
Well, I would say that we get it once it's available, okay? And we encourage people, we want to get people to get it because the numbers were very low last year in terms of getting the updated vaccination. So we want people to get it as soon as it's available. and make sure that people understand that this updated vaccine is going to cover some of the newer variants that we're hearing about. And so this is actually the best way to provide you with the broadest possible protection as possible. Vaccination is our strongest protection against severe illness and hospitalization. We need to get vaccinated. And to follow along with the CDC guidance, we were recommending vaccination for everyone 6 months and over, but again, really strongly pushing it for our older population.
Thanks for that updated guidance. And Dr. Ojikutu, thank you for being with us for this entire half hour. Good to talk to you.